Picture this: you're lying in bed, trying to relax after a long day, but your knees are throbbing. You're not moving, you're not putting weight on them, yet the pain won't stop. So why do your knees hurt even when you rest? The answer might be osteoarthritis, a condition that goes far beyond simple wear and tear. It's a disease that can turn your joints into sources of constant discomfort, even in stillness. In this video, we'll take you inside your knee joints to understand what's really happening. We'll explore why the pain doesn't take a break when you do, and what you can do about it. Let's uncover the mystery behind resting knee pain and discover why movement might be the key to finding real relief. What is osteoarthritis? Osteoarthritis, or OA, is the most prevalent form of arthritis globally, affecting millions of people across all walks of life. Imagine your knee joint as a sophisticated, finely tuned hinge, where the thigh bone, shin bone, and kneecap all meet and move in harmony. In a healthy knee, cartilage covers the ends of these bones, a smooth, resilient, and slippery tissue that allows nearly frictionless movement and absorbs much of the shock from walking, running, or jumping. But in osteoarthritis, this cushion, the cartilage, gradually becomes thinner and rougher, eroding over time. When cartilage wears away, your bones lose their natural buffer and begin to rub directly against each other, bone on bone. This increased friction triggers a cascade of changes, including ongoing inflammation, which leads to pain, swelling, and increasing stiffness over time. The knee is particularly vulnerable because it's a weight-bearing joint that supports your entire body and endures tremendous stress every single day. Every step you take, every flight of stairs you climb, every squat or lunge piles pressure directly onto your knees. And as your cartilage wears out, even simple daily motions can become a source of discomfort. Several factors heighten your risk for developing knee OA. Age is one of the most significant. Osteoarthritis is most common in people over 40, but it can strike younger adults, especially those with a history of knee injuries. Women tend to develop osteoarthritis of the knee more frequently than men, especially after middle age, likely due to differences in hormones, muscle mass, and joint structure. Other powerful risk factors include carrying extra weight, which increases the burden on your knees with every step, a prior knee injury or surgery, repetitive stress from certain jobs or sports, genetic predispositions, and even metabolic conditions like diabetes. Some of these risk factors you can change, others you can't, but understanding them gives you the power to take early action. Why pain persists, even at rest. In the earliest phases of osteoarthritis, most people notice their knee pain is closely tied to movement. Walking, running, or climbing stairs bring a familiar twinge. When you rest, the pain fades. But as osteoarthritis advances, this changes dramatically. Instead of giving you a break, the pain lingers. And sometimes, it even intensifies at night or when you're sitting still. Why? It all starts with chronic inflammation. As cartilage continues to wear away, your joint's natural repair processes ramp up. Your body dispatches enzymes and inflammatory molecules, matrix metalloproteases and cytokines, to clean up damaged tissue. But in osteoarthritis, the damage outpaces repair. The inflammation spreads beyond cartilage, engulfing the entire joint, including the synovial fluid, the lining of the joint capsule, and surrounding structures. These inflamed tissues swell, causing extra synovial fluid to accumulate inside the knee. The increased fluid stretches the joint capsule, putting pressure on nerve endings that detect pain. This stretching and pressure inside your knee can trigger pain signals even when you're not moving. In other words, the joint itself is setting off the alarm, whether you're active or at rest. But that's only part of the story. As osteoarthritis worsens, your nerves become more sensitive, what experts call peripheral sensitization. Repeated exposures to inflammation, pressure, and micro-injury train your nerves to overreact, so they start firing pain signals at lower thresholds, even in the absence of major discomfort. The ache that began only with strenuous movement now becomes a background hum, present during everyday life and silent moments alike. Rest, which once brought relief, isn't enough to dampen these nerves. Meanwhile, having too much stillness brings other surprises. Inactivity causes the joint capsule, the tough bag enclosing your knee, to become stiffer, while synovial fluid, a lubricant that should be thin and flowing, becomes thicker and more sluggish without movement. When you're inactive, your cartilage doesn't receive the nutrients it desperately needs, because cartilage is nourished by the pumping action of bone ends moving together and apart. Less movement means less nutrition, more waste, and more irritation. All this results in a negative cycle. Inflamed tissues and stretched capsules send pain signals even during rest. Chronically irritated nerves make the joint feel hypersensitive. Weakened muscles around the knee, especially the quadriceps and hamstrings, can't provide enough support, making your knee less stable. Instability translates into micro-movements inside the inflamed joint. Even small shifts, like rolling over in bed, can send jolts of pain through sensitized nerves. Over time, the background ache becomes a new normal, and you feel discomfort at rest, especially after long periods of inactivity or overnight when your body is at its most still. Symptoms and everyday signs. Osteoarthritis of the knee reveals itself through several recognizable symptoms. The most classic sign is pain, which starts mildly and gradually worsens as the disease progresses. Early on, the pain appears mainly during or after activity. Walking, climbing stairs, or standing for long periods all bring a familiar ache. Eventually, pain can persist even when sitting down or lying in bed. Morning stiffness is another hallmark. Knees often feel rigid or locked up when you first wake or after any extended stillness. This stiffness usually loosens up within 30 minutes as you start moving again, but can return after inactivity. You might also experience crepitus, grinding, clicking, or popping sounds when you move your knee. These noises happen as rough bone surfaces rub against each other, or as ligaments and tendons move over joint irregularities. The joint may become tender to the touch, swollen from extra fluid, and occasionally feel warm. Instability is common too. Some people report their knees give way unexpectedly, often because weakened muscles can't stabilize the joint well. In later stages, pain can be so persistent that it wakes you at night or keeps you from falling asleep. It's important to understand the difference between osteoarthritis and a one-time injury or sprain. OA symptoms build over months or years, rather than arriving suddenly after a specific incident. They become more frequent and severe without intervention. Perhaps most importantly, if your knee pain is severe enough to wake you at night, keep you from your usual activities, or does not improve after a few weeks of gentle exercise and self-care, consult a healthcare professional. Early diagnosis and intervention can slow osteoarthritis and sometimes prevent permanent joint damage. Persistent knee pain at rest is usually a sign that osteoarthritis has progressed. You're not alone, and this is not the end of your journey. By understanding the mechanisms at play, you gain the power to take control and improve your knee's future. You've discovered how movement, weight management, and targeted therapies work far better than complete rest. Even in the face of chronic pain, hope exists. Treatments can help, and so can simple daily habits. Your knees were made for motion, and the paradox is, gentle movement helps you find the peace stillness promises, but rarely delivers. Give your knees the movement they're craving, because even joints need a little action to find lasting relief. If you are feeling worse and want some help, call us for a free second opinion, or visit our website for more information at texasbackrelief.com at the end of the video. If you found this video helpful, please like, subscribe, and share your own knee pain story in the comments below. Let's help each other find better outcomes and a healthier, more active life together.